Good evening, and welcome to our Tuesday Talks webinar. My name is Susan Brown, and I am the Associate Director of Parent and Family Programs. It's our pleasure to be hosting this evening's webinar, Preparing for the Semester's End and Managing Final Stress. This evening, you'll be hearing from Keen Cahoon, Associate Director of Student Support and WeCare, and Dr. Robert Klein, the Executive Director of University Health and Counseling Services. We will be doing a presentation, and at the very end of the presentation, we invite you to type questions into the Q&A pod on the right side of your screen. So let's begin. Review the agenda tonight. So we're going to talk a little bit about preparing for final exams, the end of the semester checklist, what your student needs to know, how you can help your students manage their stress, some of the support services that are available to them, and health and wellness. And like I said, at the end, we will do a Q&A for you. So just to give you a little idea of what the next couple of weeks are, December 6th, which is next week, hard to believe, is our last day of fall classes. December 7th will be a reading day, and there'll be no classes that day. And December 7th also is the last day for your student to drop a class with a W grade, so please keep that in mind. And then final exams are December 8th through the 15th. So we're doing this presentation right now because we know this is a time that things can happen for your students. They're under a lot of stress, especially first-year students. It is a time where they are thinking about coming back home and the end of the semester, moving out. And it also is a very popular time to get a cold and flu right in the middle of the finals. So we hope that doesn't happen, but we do want to prepare you with some little tidbits for them. So moving along, students may be tired and stressed at this time. I think it's important to remember in the next week or two, your students may not be the same students they were 2 weeks ago. They are feeling tired and stressed. Like I said, the first-year students, they're not used to what finals are and how much is involved in studying. But keep in mind, offer encouragement, remind them that the semester is almost over and they will get through this. Important thing as a parent, what you can do is maybe send a card, thinking of you card in the mail. Students love to get mail. I know we're all into texting and emails and things like that, but maybe send them a little care package, maybe a fruit tray, a cake, something to brighten up their day. And keep in mind, your student may not be available to you as they have been, and that's okay. I know a lot of parents want to hear from their students daily, whether it be a quick text or just a hi, how are you? But the final season is a very busy season, and students may not forget to reach out to you and touch base. And remember, that's okay. They'll be home shortly. So how can you help during finals? If your student calls often during final exams, remember they just want to vent to you. A lot of things, at times we find that students will call you when they're stressed the most, and as a parent, we often want to fix that problem, but really I think the student just wants to vent. So it's kind of a juggling act of how much advice to give and how much to just let them vent to you. Encourage your students to take a break during final exams. Attend a campus event. There are a lot of things going on in after hours and on campus. Take a nap, go out to dinner with a friend. Keep in mind to them to encourage them to do some of these things. If your student is coming home for the winter break, try to plan events to celebrate the end of a successful semester. I always like to think, I know when my daughter was a college freshman and they came home the first time, we planned like a special night out. A lot of times it can be disappointing as parents because they want to go out and see their friends, but I think it's important to just create a little tradition that you and your student can do when they do come home. So Keen Cahoon, as I said, is our Associate Director of Student Support and WeCare, and she's here to explain to you some of the support services that we offer students during this time. Well, we offer it all throughout the year, but especially we just want to make sure everybody's aware of it during finals exam time. So welcome, Keen.
Hello, everybody. As Susan said, my name is Keen Cahoon. I'm the Associate Director for Student Support and WeCare here at Northeastern. I've been at the university for close to 13 years, and I spent most of my time in residential life and housing before moving over to WeCare full-time close to 5 years ago. So what WeCare is, it's three things. We are an office. We are located in 104L Hall, and there'll be some contact information at the end of my portion of this presentation that you can either take a screenshot of or take a picture of. So we're located in 104L. So if people are looking to send their child to WeCare or send their student over to WeCare, that's where we are. We are a network of people around campus and sometimes off campus that help support students who may be facing a challenge. And we're also an approach. Northeastern is a very, very large institution, and I think that there are a number of times where people just aren't quite sure where they need to start or where they need to go, and our approach is trying to make sure that a large institution feels like a smaller school so that everybody is connected and there's seamless transition between one office and another. So in general and in a nutshell, what WeCare does is we work with students who find themselves in a challenging situation that may impede their ability to move forward academically. These challenges can range from being academic, solely academic, to involving something medical, to involving something financial, something personal in nature, or any combination thereof. So sometimes these problems can be very simple, it's a one and out, and sometimes, and more often than not, there's a couple of different things going on with a student and they're looking for someone to help them unravel what that complexity is for them. And then what we do with that information is we make sure that we get them connected to the right people across campus who can help them through that particular issue. Sometimes WeCare is really the gatherer of information, and then we make sure that we've got the right people who can help them through the particulars of their situation. We also provide support and guidance not only to students but also to their families and friends, because it's not always students who are calling our office or stopping by our office. Sometimes we have parents and friends who come in on behalf of the student because they're worried or because they have a question or they want to know if this is the right place for someone to come. So as I mentioned, WeCare is a place that helps students figure out how to navigate what can be sometimes a complex situation. But the WeCare office can't do it all on their own. We have an incredible network of people that we rely on to help us guide students. Some of the things that we will suggest to students, especially when they've come to us with what they feel is an academic issue, is to utilize a number of different places on campus to help them through that academic issue. And since we're talking about getting through finals, that is the majority of what we're going to see over the next couple of weeks. So the first tip that I can give you as parents to help reinforce with your students is if you find that your student is struggling in a class or not quite sure how to memorize the materials that are coming up for their finals or get through a paper, or they're not quite sure what they're looking to do because they don't feel as though they may have the right direction, please encourage them to utilize their professor's office hours. Every professor does have office hours each week, and they are there to help guide students through those last couple of weeks of school and to help give them the direction that they're looking for. While not every class has a teaching assistant, many of them do, and a lot of times those are students who have already had significant experience in that subject area and are relied quite heavily upon by the professors to help those students with day-to-day problems. So they can be an excellent resource for students when they're looking at a specific academic issue within a particular class. This is the time of papers, final projects, final papers, final lab reports. So the Writing Center can also be a great resource for students who are looking to kind of take it into that last year in order to make it through the end of the semester. The Tutoring Center. We have tutors in almost every single discipline on campus, and the two women who run that tutoring center, Tina and Maggie, are phenomenal, phenomenal people and will work to the nth degree to get someone connected with the right person to help them through and make sure that they're working with the right person to help them through the subject matter. And then last but certainly not least, whenever somebody comes to WeCare and has an academic question or an academic challenge, we are working hand in hand with their academic advisors. These are the folks that we really want our students to develop long-term relationships with, because these are the folks that are going to be their in essence, guidance counselors throughout their academic career here. So if there is a question about whether or not a student should keep a class, whether or not they should be approaching a professor, if there's a better way to approach a particular professor, email versus office hours versus catching them before or after class, the academic advisors are going to be the ones that have a lot of this information. So anytime that we are working with a student to maybe communicate with a professor or helping a student do that, their academic advisor is always going to be copied or brought into that situation so that educated decisions around academics can be made. So the list of campus resources, these are a number of different offices that we work with very, very closely day in and day out to make sure that students have a good understanding of the different offices and resources on campus. They include Office of Global Services is one of them, specifically around international student concerns and issues. You'll be hearing from my colleague, Dr. Robert Klein, in just a few moments, but we work very closely with the University Health and Counseling Center around student concerns that may involve medical or behavioral health concerns. Sometimes students come to us and they're a little bit concerned about their finances and how a particular grade may affect a scholarship, or if they were to drop a class and get a W, will that affect any of their aid that's coming through? We will make sure that they're connected directly to their financial aid advisor or to someone in Student Financial Services to make sure they understand how actions could result or affect their financial aid or their scholarship. Center for Spirituality, Dialogue, and Service is a wonderful opportunity, an office for students to talk confidentially with a spiritual advisor, and sometimes we find students find comfort in that knowledge. We have cultural centers on campus. We also have the Center for Student Involvement, a lot of times pairing up with this particular office around issues of feeling connected and finding a niche for themselves and people with like-minded interests. And last but not least, we certainly have students who come in saying, I thought I wanted to be a doctor, but I'm not really sure anymore, and I'm not quite sure where my skills lie. And we will certainly get them connected with career development around maybe where some of their interests and their strengths lie if it doesn't happen to be what they thought that they were. So those are just it's just a small sampling of some of the resources that we work with. Some of these come into great play around finals time, and others are mostly throughout the rest of the semester. But just to give you a small sample of some of the different types of resources that we have on campus. So whether it's now or moving forward, these can be resources for you as well. All right. Contact information for WeCare, and this is just how you can get in touch with us in general. We have a main phone number, which will be answered as the Office of Student Affairs and WeCare. All of us sit together in one office in 104L. The best way to contact us, quite honestly, is through email, which is WeCare@northeastern.edu, because 3 sets of eyes see those emails, and we can make sure that one of us is grabbing that email and responding to you within a day. As I said, our office is located at 104L, which is known as the Office of Student Affairs. We do have a website, which I will share is under construction right now. We are in the process of updating content. So you will see a couple things that are under construction or still coming, and that should be up and ready to go by the new year. Our regular hours are Monday through Friday, 8:30 a.m. to 5 p.m. While school is in session, we do have extended hours on Thursdays until 7, where either David Winch, who's the director, or myself are there until 7 p.m. to take later walk-ins, folks who might be on co-op or folks who might have a little bit of a later class or lab. One thing to remember, if you have any immediate concerns about your student, if you are really concerned about their well-being, you want someone to check on them right away, WeCare is not the right place to call. We're not an emergency response office. We are we're there to help support students, but we're not emergency response, and we do not carry weekend hours. So if you're calling after hours or on the weekend, you will want to get in touch with Northeastern Police Department for immediate concerns about your students, because we won't have anybody in the office after that time.
So at this time, we're going to turn it over to Dr. Klein. So welcome, Dr. Klein. Thank you so much for being with us tonight.
Thank you, Susan. It's a pleasure to be here. Welcome, everybody. Thanks for, I want to say, we don't say tuning in anymore, it's logging in. But it's a pleasure to have a chance to talk with you about the University Health and Counseling Services. Just a little introduction. The University Health and Counseling Services is known on campus as UHCS. We are located right pretty much in the center of campus on 135, the building 135 Forsyth Building. That's on Forsyth Street. The buildings and the names and the actual room numbers can be confusing, but we're right on Forsyth Street, right between the Ruggles T station, down the street, and then up the street is the Marino Center and Cadova and a couple other landmarks. But students probably know us, our location the most easily, thinking of us as next door to the Bank of America ATM and Chicken Lou's. No affiliation. The UHCS operates Monday through Saturday from September through the end of June, and then in the months of July and August, we are open Monday through Friday. So Monday, Wednesday, and Friday, we're open 8 to 5. Tuesday and Thursday, we are open 8 o'clock a.m. to 8 p.m., and Saturdays from 12 o'clock noon to 4 o'clock p.m. We are here for any kind of issue, medical, behavioral health issue, question, concern, problem that a student may encounter really at any time during their time at Northeastern. Our priority is access. It's for a student to be able to reach us and get to a healthcare provider with the least amount of delay and the least amount of any kind of bureaucracy or red tape. So we are set up for a student to walk in to UHCS and see a provider without any kind of financial transaction or insurance transaction. A student should bring their ID, their Husky ID, and they should have their insurance card, but not to pay for or use in order to get to be seen. But in case there is any need to talk about any referral care or laboratory treatment. But the idea is that a student can walk in and be seen by a clinician the same day, and that's the priority for us in the way that we are set up. We work with, as Keen mentioned, we work with WeCare, and to get an idea of just how often that happens, it's not an occasional phone call. We are in touch with WeCare numerous times every day, and the idea is to coordinate services so that we're not pointing at a building and telling a student to go to the next place to get for their next step to solve whatever problem they have. The idea is really to have a networked system of support for students. And so while observing confidentiality always, we do work with other departments and in particular WeCare on a regular basis. Okay, now I'll talk to you a little bit about the medical service. UHCS provides walk-in and urgent care for students with any kind of medical issues. Students can make appointments for gynecological exams. We also have a nutritionist a student can make an appointment to see. We have a sports medicine assessment also at UHCS. And of course, we say it as many times as we can. There is no charge for a visit at UHCS. We emphasize with students the nature of walk-in care, and we've learned that that's an important way to think about our services as opposed to urgent care. We know that there are urgent care services throughout the city, and those can be very useful, especially after hours, but we want our students to know that in order to be seen at UHCS, they don't have to be in an urgent situation, and they don't have to feel that or wonder if the problem they have is urgent enough. UHCS Behavioral Health Service operates in the same building right alongside the UHCS Medical Services. In fact, our offices are interspersed throughout the building so that there is no indication to a student whether they're going where somebody's seeing a behavioral health clinician or a medical clinician. There's no idea, well, they went to the left, I guess that means they're going to the behavioral health side or vice versa. We provide behavioral health services in a very similar manner. Students may walk in and be seen the day they come in, and UHCS provides the ability to meet with a licensed behavioral health professional to have an assessment, of course, to consider if there are any ongoing issues, but in particular to assess what is happening now, what is the immediate stressor for a student, along with what other kinds of ongoing issues and situational issues they might be dealing with. We also provide medication assessment and treatment, and that's done by referral. We call it in-house referral. Our clinicians can make a referral to prescribing clinicians right here in UHCS, so students can be assessed, started on treatment. We have group counseling throughout the year, and as of last year, we began a group during the summer term as well. Support groups for students cover a number of topics. We do get feedback from students and requests for various topics for our groups. However, we also we pay close attention to the circumstances, concerns, conditions that affect college students in particular, and we look at data, national data and local data that tell us what are the biggest concerns and impediments students face in their health while they're in college, and we use that information also to inform the group topics. So in any given semester, we might have 6, 7, 8 different support groups that usually cover issues, general issues such as depression and anxiety, usually a group or two that deals with adjusting to college life, connecting on campus. A freshman support group was one of the groups we had this fall. We've had various groups on dealing with stress, coping with stress, groups to support survivors of sexual violence, group for athlete support, and we had a group this fall on identity-based trauma, support group for marginalized and underrepresented students, and we find these groups are popular and sought after, and however, each semester we make a decision as to whether we might change the group content in response to any particular requests or trends. The last mention on this particular slide, referral to community clinicians, speaks to an important part of our service model. Our mission is to be accessible to students without having appointments that are days or weeks out into the future, really to be available as a student needs us. In addition to our access, an important part of our service model is leveraging the resources of our particular community and our situation in Boston. We are Northeastern, for those of you who are not local or familiar with the setup of the medical area around us, Northeastern is situated literally between in the middle of 5 world-class hospital and medical centers. Most of these are part of medical schools and specialty and outpatient practices, and this provides us a wealth of resources to which we can refer students for continuing care and specialty care. And so we have a staff of referral coordinators. They're called referral and insurance coordinators. Their job is to provide an appropriate clinician that when a UHCS clinician recommends a referral, the referral coordinator looks amongst the clinicians that match the specialty, the insurance plan the student may have, any preferences the student may have in terms of a clinician. And so when it comes to behavioral health, if a student may want a female therapist or a male therapist or someone who is closer to where they are living or perhaps closer to where they're having a co-op, and our referral coordinators will identify clinicians with whom we've had experience and clinicians whose licensure and so forth we have verified, so that a student's not making a cold call or a call out of a catalog. The clinician is vetted for providing the particular treatment that we've recommended for a student. We have looked to see that that clinician is available and that it is a match for the student's insurance plan. And by having a robust referral service and also having an excellent student health plan, we can help students avail themselves of excellent ongoing care as well as the immediate access that they have at UHCS. And certainly during finals, of course, stress is high. It's not only, it doesn't only lead to increased behavioral health concerns, it leads to more concerns about everything. The challenges students face to get a good night's sleep, to stay nourished and even hydrated while they're trying to get everything done can create quite a challenge. It can lower students' immunity, and so we know that it's a time where students have stress and students can get sick, and so our access model is particularly important at a time like this.
We're going to talk a little bit about after-hours care now, and then we'll start taking some questions from people. So.
And I just want to mention treatment at UHCS is free, it's confidential, and it's accessible, and that's really the take-home message we want students to have. After hours, and students are able to access care. They have a number of options. There are excellent healthcare resources available quite locally to students. I've listed a few of the more popular ones. Students can go to the Whittier Street Health Center, which is a block away, essentially, from one of the corners of our campus, and the hours on Saturday are earlier. A student may find it more convenient to go if they're closer to Whittier Street. The Beth Israel Deaconess Urgent Care at Chestnut Hill, a little farther away, but a direct, really a straight shot from Northeastern in Newton, and with a bit more flexibility in the hours. Partners Urgent Care and Mass General also has an urgent care center that we have on our website that provide hours on Saturday and Sunday as well. Our campus public safety are also available for any kind of first response whenever UHCS is not open. Even when we are, NUPD has emergency medical technicians on its staff, and they're extremely responsive. And I'd say this even if they were in here with me. They are tremendously respectful of students and do an excellent job in making an assessment and making an immediate decision of what kind of care a student may need after hours.
So at this time, we're going to start taking a few questions. So Dr. Klein, you talked a little bit about some of the services. Can you talk about what kind of a wait a student would have if they walked in for urgent care or needed medical assistance right away?
Let's see, for a behavioral health concern, the waits may range anywhere from actually, believe it or not, being able to just check in, needing the 1 or 2 minutes for a behavioral health clinician to come out. It's typically in the area of 15, 20 minutes. There are certainly times when it can be busier and the wait might be even a half hour or longer. The medical clinicians also work, as I mentioned, in a similar manner of walk-in. The wait times may be slightly longer for the medical service. There are particular times of day, particular times of year that can be busier, and it could be usually could range from 20 to 30 minutes, but but when we're busy, students may wait up to an hour or more during our busier times. What we try to do, though, in comparison to any of the resources around us, our wait times, the time it takes for a student from walking into the door to actually being seen by the medical clinician is faster by far than any of the emergency departments around us, and so students find coming to UHCS even when there is a wait to be much quicker, and also a lot fewer steps, whereas some of the emergency departments may be you wait to go into one room and then you wait in that room and so forth. And that's about that. That covers the waiting.
So can you talk about WeCare? Can you just tell a little bit about what the difference is between WeCare and some of the services that Dr. Klein's area provides?
Yes, in a nutshell, the question is WeCare the same as mental health or behavioral health services? And the answer is no. David Winch and myself, we are not clinical in nature at all. We do not have clinical backgrounds. We are not trained to work with students on their behavioral or medical issues. What we do work with them on are the ripple effects that happen as a result of that. So if someone has come down with some sort of illness, whether it's mono, whether it's the flu, whether it's strep throat, and it's caused them to not be able to do something, whether it's in class, whether it's with a group, whether it's paper, group presentation, participate in a sporting event, anything like that, we help the students manage what those ripple effects are. When it comes to working specifically on the medical issue or the behavioral health issue, we leave that to our clinical professionals here on campus to work with the illness itself and everything that Dr. Klein just talked about. But again, we work hand in hand to make sure that all the different aspects of the university life that are affected by something like that are handled.
Thank you. Talking a little bit about the health plan. Can anyone go into the health center and be seen, or do they have to be on a health plan?
There is no need to be on a health plan to be seen at the UHCS. Undergraduate students are automatically enrolled, subscribed to UHCS services, and a student may opt out, but we advise strongly against that. The health services are a tremendous value, and we strongly recommend that they keep this option. But we do not reject health plans, and we don't accept them either, because a health plan is not necessary to be seen at UHCS. There are certain charges associated with treatment at UHCS, and that would include laboratory services. We have a lab on site, but lab services are billed to the student's health plan, and so it's important for a student to have and it's a Massachusetts law that a student have health insurance, You can look on our website for information on that. The Northeastern University Student Health Plan, or NUSHIP, also has information about health insurance requirements. But a health plan is not necessary to come into UHCS.
About how many doctors and nurses are on your staff?
Okay, the number of clinicians varies because we have, along with our permanent staff, we have sports medicine fellows from the Children's Hospital Sports Medicine program that also provide service to our students. I mean, we between our services together, upwards of 25 clinicians, but not all the clinicians have the exact same hours and so forth, so that number may vary from day to day, hour to hour. But we are staffed with physicians, psychiatrists, nurse practitioners in both medicine and behavioral health, psychologists, PhD, and social workers. We've had physician assistants on our staff, registered nurses, doctors of nursing practice. It's a very wide range of staff, very similar to a community health center.
So, Keen, we're approaching the holiday break soon. What resources will be available to students during the break time? I know many of the campus offices are closed, but so our break is not, of course, as long as the students' break. So
I think it's important for parents to know that finals end on Friday the 15th, and any student that is heading home will be heading home sometime on the 15th or 16th. We do have many residence halls that will remain open, and there are 3 or 4 services on campus that are considered 24/7, 365. Those services are residential life, because our halls do stay open, because we do have students who are on campus for co-op throughout the year, and they don't go on the same break periods. Northeastern Police Department is also 24/7, 365. There are always our police officers on call and working shifts, all 3 shifts, so they're here. Facilities is also open throughout the break, again, a 24/7, 365 operation. As of Friday, which I think is the 21st or the 22nd of December, so that's a full week after finals have ended. For that full week, in between finals and Christmas, the Christmas holiday, the university is open for business, regular business hours. However, as of 5 p.m. on the 22nd, the university does close down for the holiday break, and we are closed until 8:30 a.m. on January 2nd. So offices such as University Health and Counseling, WeCare, academic advisors, financial aid, the housing office specifically, not residential life, not the in-hall staff, but housing services, the university is closed. There will be certain offices that are open on specific days to conduct business, because we can't shut down for a full week and a half. So financial aid, the registrar, housing services, admissions, there will be certain offices that are open occasionally throughout that time, and you would have to look at a particular website to find out what days they will be open. But again, we will reopen as the university on January 2nd at 8:30 a.m.
we have a parent asking, I think I know the answer to this, their student's roommate moved out and he has not been reassigned a roommate. Due to the only a few more weeks left in the semester, I would assume that he will not have a roommate, but during the spring semester when he comes back, I would assume that a new person would be assigned to that room.
Absolutely. Given the incoming students from NUN, every single space on campus will be accounted for. However, in the rare case that a student does not get a roommate for second semester, that to start when they move back, it is very unlikely it will stay like that, because we do have students who will be moving around or being pulled off of, who've come in late asking for housing. So every available space will be taken. So for any parent who has a student in that particular situation, again, as a former Res Life professional, where it's still near and dear to my heart, please make sure that your student cleans up their side of the room and make sure that the other bed, the other desk, the other bureau, the other closet is ready to accept that new student.
Mm-hmm. So we have time for like one or two more final questions. If your student is seen for an assessment, Dr. Klein, how do they have access to that report and the referrals? I would imagine they do if they were sent for a referral.
Yes, this is a question, if I understand correctly. This is does the student have access to the assessment itself and any other referral information? UHCS follows Massachusetts law and federal law where regards confidentiality and access of information. A student may access their medical record and request a copy of it. In fact, and that would include the assessment and any information about the referral itself. There is any clinician's office standard information release form, if it's in Massachusetts, is sufficient. However, we have a release form, a record release form on our website under the forms section, and if the student fills out that forms section, it asks specifically what records do you want, what subjects, what clinical topics do you want to include, and what date range do you want records from. And it's very important that the student fill out all of those questions because, again, the law is very careful to protect the patient and to allow the patient to request very specific types of information. And so when that form is filled out, signed by the student also designates where that information should be sent. And and a student should send that to UHCS. There is a fax number. The form itself actually comes with an instruction sheet. That form can be faxed or dropped off at UHCS. We will review it, and our records office will send that information to the student, so the student can actually have a copy of their medical record or any part of it.
So, Keen, if a student is heading out to the NUN program for the spring semester, do you happen to know the date that they need to move out?
So technically students are supposed to, if they are, whether they're staying or not, they here on campus in Boston or potentially going abroad, going on co-op, going to NUN, they are supposed to be moving out within 24 hours after their last final. We as a university, while we want to encourage students to get home as quickly as possible, recognize that that is not always the case, especially when travel is involved and we've got parents who are coming to help move their child out, or they have to fly home or they have to drive home with their belongings. But for anybody who is going somewhere else for next semester, they're going away from campus for co-op, NUN, et cetera, they do need to move out on the last day of finals. Or 12/15, December 15th, whichever comes first. If that is not possible, what they should be doing right now is working with their residence director or their area coordinator, whichever professional person is in their building, to work on a move-out date, because we do want to encourage students to head home or head to where they're going as soon as possible, and that allows us to also start to close down buildings that do not need to stay open past the 15th. So if they do need to stay later than the 15th, because they will need to move all of their things out and they need your help to do so, please make sure they're in touch with their residence director or area coordinator as soon as possible so they can make appropriate arrangements.
So at this time, I just want to show the dates again from those who may have joined us late about final exams. So December 6th is the last day of fall classes. December 7th will be a reading day for students, time to catch up. And December is also the last day to drop a class with a W grade. Finals will be December 8th through the 15th. I do know that we may not have gotten to everyone's question, and I do want to put out my email address. You could email parents studentlife.northeastern.edu if we do not get to your question, and I will be sure to forward that to the correct person. And thank you again for joining us, and I hope you and your student have a successful end of the academic year, and when they do come home, you get to enjoy some nice quiet time with them and some family time. So thank you again for joining us tonight.